Listening to English conversations is one of the best ways to improve our language skills. Every time we hear real-life dialogues, we pick up new vocabulary and get a better sense of how the language is used naturally in everyday situations. In today's episode, we are diving into a vital topic that affects every aspect of our lives: hygiene. Join Dr. Emily and John as they explore the science, challenges, and future of cleanliness in our homes, communities, and beyond. Let's start.
Dr. Emily, it's an honor to finally meet you in person. I've been following your work on public health and hygiene education for years.
Thank you, John. It's always encouraging to see younger generations take a serious interest in hygiene. It's a topic that's far more critical than people realize.
Especially after the recent pandemic, it really opened our eyes to the invisible world of germs and how essential cleanliness is to our lives.
Absolutely. And yet, many still confuse being clean with being safe. A spotless-looking surface isn't necessarily free of microbes.
That's exactly why I wanted to talk with you. I'm working on a documentary titled Cleanliness is Life, and I'd love for it to be a deep exploration, starting from the science behind it all.
That's a brilliant initiative, because ultimately, cleanliness isn't just about appearances. It's about health, prevention, and even self-respect.
Let's go back to the roots. How do scientists define cleanliness?
Scientifically, cleanliness is the absence of dirt, germs, and harmful contaminants. But it's more complex than that. In practice, we distinguish between several levels. Cleaning removes visible dirt and debris. Sanitizing reduces the number of germs to a safe level. Disinfecting kills most pathogenic microbes. Sterilizing eliminates all forms of microbial life, including spores.
So wiping down a surface with a dry cloth might make it look clean, but it's far from disinfected?
Exactly. That's one of the most common misconceptions. A surface can appear spotless but still harbor millions of bacteria.
How do scientists measure this?
In labs and healthcare settings, we use methods like microbial swabs, culture tests, and ATP meters. These tools help assess cleanliness on a microscopic level.
I think people would be shocked if they knew how many germs are around them every day. Could you share some facts that would really make people rethink their habits?
Certainly, a kitchen sponge can host over 10 million bacteria per square inch, far more than a toilet seat. Mobile phones often carry 10 times more germs than public restroom surfaces. Remote controls, elevator buttons, and keyboards are some of the filthiest items we use daily. Office desks may have 400 times more bacteria than a toilet seat. Indoor air, especially in poorly ventilated homes, is often 2 to 5 times more polluted than outdoor air.
That's honestly alarming, especially the phone part. I never even think of mine.
You're not alone, and as bacteria become more resistant to antibiotics, routine cleaning and disinfecting become even more crucial.
Let's connect the dots. What do studies tell us about the relationship between cleanliness and health?
The connection is clear and powerful. Consider these key findings. The World Health Organization, WHO, estimates that proper hand washing alone can reduce infectious disease transmission by up to 50%. The Centers for Disease Control, CDC, report that healthcare-associated infections, HAIs, cause nearly 100,000 deaths annually in the U.S., many of which could be prevented with better sanitation. In developing countries, improved sanitation and home hygiene reduce diarrheal diseases by up to 40%. Schools that maintain better hygiene standards report higher attendance rates and better academic performance. Clean workplaces reduce sick days and improve employee productivity.
So it's not just a health issue, it affects education, productivity, and even the economy.
Precisely. There's even a psychological angle. Messy and unclean environments increase stress, while clean, organized spaces improve focus and emotional well-being.
That's fascinating. I've read about environmental psychology. It shows how surroundings shape our behavior and health.
Exactly. So when we say cleanliness is life, we're not exaggerating. It touches every area: physical, mental, social, and economic.
Dr. Emily, most people assume their homes are clean, but what are the dirtiest places in a typical house that we should really be concerned about?
That's a great question, John. On the surface, our homes may look spotless, but under a microscope, it's a different story. Here are 10 of the most contaminated spots in the average home. Kitchen sponges and dishcloths. These stay moist and warm, creating the perfect environment for bacteria like E. coli and Salmonella. Toothbrush holders, often neglected yet exposed daily to bathroom humidity and airborne germs. Bathroom sink and faucet handles, touched frequently with dirty hands. Cutting boards, especially when used for raw meat and not disinfected properly. Doorknobs and light switches, high-touch surfaces that often go unclean. Remote controls, used by everyone, rarely cleaned, and often full of skin cells and bacteria. Pet bowls and toys, these can harbor bacteria and parasites, especially when not washed daily. Microwave and refrigerator handles, often forgotten in regular cleaning. Shower curtains and bathroom tiles, prone to mold and mildew buildup. Laundry baskets and hampers, they collect sweat, skin cells, and bacteria from dirty clothes.
That's a shocking list, especially the toothbrush holder. I never thought to clean that. How can we clean our homes to make them truly safe, not just tidy?
Start with the basics. Pre-clean surfaces to remove debris. Use the right disinfectants for each area. Allow proper contact time. Most disinfectants need a few minutes. Ensure good ventilation. Use microfiber cloths. They trap more bacteria.
Are natural cleaners like vinegar effective?
For light cleaning, yes, but not enough for strong pathogens. Use hospital-grade disinfectants when needed.
What are common mistakes?
Reusing the same cloth everywhere. Ignoring high-touch areas like remotes and handles. Not letting disinfectants sit long enough. Forgetting to clean tools like sponges and mops.
How can people keep their homes healthier?
Wash hands often. Disinfect daily use items. Leave shoes at the door. Use HEPA filters. Wash bedding weekly. Replace kitchen sponges regularly.
What about public hygiene?
It's a shared challenge. Public areas need regular cleaning and responsible behavior. Countries like Japan and Singapore lead with discipline and smart policies.
How is technology helping?
Smart bins and UV robots clean efficiently. Self-cleaning toilets and touchless systems reduce contact. Apps let people report hygiene issues instantly.
How can we promote better habits?
Use catchy campaigns like catch it, bin it, kill it. Educate children early. Repeat simple hygiene messages often.
What home tools are worth having?
Steam cleaners, electrostatic sprayers, robot vacuums, touchless dispensers.
What does the future of hygiene look like?
Smart cities with sensor-based waste systems, antimicrobial surfaces, portable UV devices, AI hygiene assistants.
Will we still need to do our part?
Always. Technology helps, but real change comes from people practicing good habits and working together.
Final thoughts?
Start small, stay informed, be consistent. Cleanliness is more than a chore, it's a way of life.
Thank you, Dr. Emily.
Goodbye.
And now, that's the end of this episode. We hope you found it helpful and inspiring. Don't forget to like and subscribe to the channel so you never miss an episode. See you next time.